All right, if you're a student nurse, listen up because you're going to be giving insulin, a whole lot of it. And one of the most powerful and, let's be honest, riskiest types you'll handle is rapid-acting insulin. Getting this right isn't just about passing a test, it's about keeping your patients safe. So let's break down exactly what you need to know.
Here's our game plan. First, we'll talk about its main job, which is covering meals. Then, and this is the big one, we'll get into its speed profile. That speed pretty much dictates everything: how we use it, how we dose it, and how we handle the risks. Then, we'll wrap up with your super important role in teaching patients how to manage this safely on their own.
Okay, let's start at square one. What exactly is this type of insulin, and why is it so connected to food?
The easiest way to think about it, it's like the body's natural mealtime response, just in a vial. See, whenever someone eats carbs, their blood sugar naturally goes up. The whole point of rapid-acting insulin is to jump in there super fast and control that specific spike, doing exactly what a healthy pancreas would do without even thinking about it.
So, its job is really specific. Number one, crush that glucose spike right after eating. We call this meal coverage. But, and this is key, it's not a solo act, it's a team player. It works alongside a long-acting insulin, which we call basal insulin. That basal insulin provides a slow, steady trickle of coverage all day long to keep things stable between meals.
You're going to hear it called a couple of things on the floor: mealtime insulin or bolus insulin. Keep your eyes peeled for these names on the MAR. Lispro, Aspart, and glulisine. They're the big three you'll see and be giving all the time.
Okay, now for what is, without a doubt, the most important thing you need to understand about this drug. It's speed. Seriously, understanding how fast and when is everything for patient safety.
Just look at that onset time, 10 to 15 minutes. That is unbelievably fast. From the second you give that shot, it is on the job, lowering blood sugar. It hits its strongest point, its peak, in about an hour or two, and then it hangs around for about 3 to 5 hours. That speed is its greatest superpower, and also its biggest danger. And this brings us to the golden rule, the one you can never, ever break, because it starts working in minutes. The patient's food tray absolutely must be right there in front of them when you give the injection. If they get the insulin, but there's a delay in eating, you're basically paving the road to a dangerous drop in blood sugar, which is hypoglycemia. So, we know what it does and how fast it works. Let's talk about who gets it and how we figure out the right dose. This is where your nursing judgment really starts to shine.
For a patient with type 1 diabetes, this insulin is a fundamental part of their daily life. It's what they use to cover every single meal in that basal bolus plan we talked about. Now, for patients with type 2, it's usually brought in a bit later, when oral meds just aren't cutting it anymore, especially for those really stubborn blood sugar spikes after they eat.
And listen, this is so important. There's no such thing as a standard dose. It's not one size fits all, not even close. Every single dose is customized for that patient at that exact moment. You've got to look at their current blood sugar, how many carbs are on their tray, how sensitive their body is to insulin, even if they're going to go for a walk after they eat. It's a fresh calculation every single time.
All this speed and power brings us directly to your biggest job as a nurse, making sure your patient is safe. This medication demands your full attention because the risks are very real.
Let's be crystal clear about this. The number one, most common, and most serious risk of giving rapid-acting insulin is hypoglycemia. That means dangerously low blood sugar. This is the one thing you are always working to prevent. You need to have these signs burned into your brain. If your patient suddenly starts sweating, gets shaky, tells you they're starving, feels dizzy, or seems a little confused, your internal hypoglycemia alarm needs to be blaring. Catching it early is everything. Your entire workflow for this can be boiled down to 3 critical safety checks. First, you assess. Check the blood sugar, make sure the food is there. Second, you administer correctly. Right patient, right dose, right time. And third, you monitor. Keep an eye on them for any of those early signs. Assess, administer, monitor. That's your safety net. And finally, your job doesn't stop once the injection is given. A huge part of being a great nurse is being a great teacher. You have to give your patients the knowledge to manage this powerful medicine safely by themselves once they go home. You can walk your patient through this exact thought process. You say, okay, if you start feeling shaky, what's your immediate move? You eat or drink your fast-acting glucose. And then you connect it back to prevention. And how do we try to avoid that feeling in the first place? We never, ever skip a meal after taking our insulin. It helps them connect the dots between symptoms, actions, and habits. And don't forget the practical stuff, the housekeeping. Insulin is delicate. You'll teach patients that brand new, unopened vials live in the fridge. But once you open one, it's okay at room temp. The big no-nos: never freeze it and don't leave it in a hot car or sitting in the sun. If you do, it just won't work right.
So we'll leave it here. You get it now. You know how fast it works, you know what it's for, and you know the biggest dangers. The real question is for you. When you're on the floor, how are you going to use this knowledge to guarantee your patient's safety with every single dose? Answering that question for yourself? Well, that's the heart of being a nurse.